Hello there, this is Dr. John Malik again, here from the Beloved Medicine Clinic. We're recording our third video with the diabetes, and we're gonna be talking about the clinical picture of diabetes. The clinical picture of diabetes is so wide, so we'll focus on the common parts and also what we call the complications of diabetes. I will start with the common ones with how do you know that you might be having diabetes. The first one is what we call the manifestations of hyperglycemia or high levels of blood glucose. When the glucose increases in your blood, it creates what we call high pressure inside the blood. Pressure means there is a lot of stuff inside your blood that needs more water. So you feel that you're over thirsty, and when you're over thirsty, you drink a lot. Then, because the water increases and the glucose increases, you directly start to void more. So what we call increased thirst, increased hunger, increased urination. Okay, and these are the most common ones, and many people already know about this. The part that not too many people pay attention to is that diabetes might present with what we call the complications. The complications can be many things, and I will start with the eyes. Diabetes has many complications on the eye, but it usually presents with blurring of vision or decreased vision. So if you're having consistently decreased vision or blurry vision that comes and goes, or what we call fluctuates, go ahead and check two things: your eye doctor, and also check your blood sugar levels, or maybe go to your primary care physician and get that checked out. Number two, it can present with something totally unexpected, especially that it has been there for a while. By the way, any person who gets diagnosed with diabetes, especially type 2, you get diagnosed 5 to 10 years after you actually develop diabetes. Very few patients develop what we call silent heart attack, and this is when they know that they have diabetes. Of course, they develop chest pain, sometimes they don't, but this is one of the incidences that people get to know that they have diabetes. The third complication is what we call like the delayed one. It can be erectile dysfunction. It can be some urinary dysfunction, but these are what we call late. And again, those complications are multiplied whenever diabetes is having the co-pilot, the lethal co-pilot, which is smoking. Diabetes might also present with the kidney complications. These are usually very silent, and you don't know about them unless you develop blood work. It can also present with what we call peripheral vascular disease. This is where people develop, decreased blood supply to their feet and legs, and eventually, if untreated, of course, can reach the inadvertent point of gangrene. Someone might ask, okay, now I have diabetes. Am I going to develop all those nasty complications? Oh no. Only if you neglect it and you keep doing what you're doing. If you change your way, if you change the way you eat, the way you have your lifestyle, and you start taking your medication, definitely you live a near normal life. And I'm gonna repeat myself again for why I say near normal, because you're just gonna be taking medication. The last one that we're gonna be talking about is diabetic neuropathy. And sometimes when you have diabetes for a long time, you start developing numbness or tingling in your fingers or toes, most commonly known in the toes, feet, where you develop two things: decreased sensation and increased pain. That there is no physical reason for the pain, it's just that the nerve is giving a wrong signal because of the pain. In a later video, we'll talk about the treatment for everything of those, but this is a highlight of the most common presentations of diabetes and its complications. All right, we will see you later in the following video. Thank you.